This is going to be a kind of short video. I keep saying I'm going to do an intro video and, I need to do something with all this and before I do it, but I feel like I'm getting behind and I'm not really, doing what I should be doing. And I want everybody to understand how complicated these clinical trials are and all the stuff you got to go through. And this is a quick update. In the past week, to get ready for the trial and the surgery, I've had to have an MRI of my brain, which we were overdue for anyway because I have 6 brain lesions, maybe 7. We're not positive. Is one that's kind of deep, and we just keep an eye on it. But that all looks good. I've had an echocardiogram. It's where they do the ultrasound and hook you up and then give you some dye and see what your heart's doing. And that was all good. I've had a CT of the chest and the abdomen with and without contrast. I've had a pulmonary function test. And tomorrow morning we go, which would have been my normal chemo day. I'm going to the pre-op and I'll have more blood work done. I've already had blood work twice. I have more blood work done, and I'll talk with the nurse practitioner, the oncological nurse practitioner, about my test results. But my doctor stays in touch with me and he calls me all the time. And you can see that's from accessing my port yesterday or day before. I'm still exhausted. It's 100 miles one way for me. Well, 96 odd miles. And back and forth is kind of tough. And sorry, I'm going to take that off. But anyway, it's a lot of testing to get ready for the clinical trial and the surgery. And I'm very, very fortunate to be in the surgery. I don't mind the testing whatsoever because, in the end, I'm hoping, even if this doesn't work for me, the dosing will be found because this phase 2 trial, this is a dosing trial. And hopefully, they'll be able to find a dosage that works for people and, hopefully eventually get a cure for it. The best we can hope for is remission. If I get a couple of years out of this, I'll be super happy. I've already lived longer than, I anticipated. My doctor kind of chuckles and goes, I knew. Yeah, well, he just likes to prove me wrong because he doesn't get a chance to very often. I'm very in tune with my body and I do a lot of research. And when I say research, not just, Googling something and reading whatever results come up from Google. I mean, you've really got to dig deep. YouTube, believe it or not, has a lot of really informative videos. Excuse me. And it's really easy to get sucked down a rabbit hole of bad information. So be careful there too. And as well as Google, try to stick with the hospitals, the universities, the real studies, medical journals, things like that, to find your info because there's so much crap out there. Even support groups on Facebook. I posted something about this trial the other day on a support group I'm in for non-small cell lung cancer. And I had 2 people come on there trying to sell snake oil, cannabis oil. It's crazy. Hey, look, it works for some things, but it doesn't cure cancer. And it just irritates me when they do that. Anyway, enough of that. But where we're going from here is the surgery, and then they'll send my my biopsy off and they'll make the TILs, and from there we'll just wait. And when I have new tumor growth, we will we'll go in the hospital and start the treatments. And it'll be, full-blown chemo. They'll, totally suppress my immune system and then give me the LN-145 TIL, which they made from my tumors. So it's a type of immunotherapy. And we just sit back and hope it works. And just, stay positive and try to remember that, not, they're practicing medicine here. Nobody's an expert at anything. And if they say they are, then, you should be really careful. But anyway, we'll probably do some other videos, and I will probably, redo some of this video. So you may see me in a different outfit going through it. And I'll try to, put the name of the trial itself, because I cannot pronounce this. It is an Ivance, and I'm reading from this, if you can see it. I'm going to flip my camera around, maybe. All right, so this is the trial that I'm in. autologous, I guess, tumor infiltrating lymphocyte LN145 in patients with metastatic non-small cell lung cancer. So this is phase 2 trial. Like I said before, this is a dosing trial. And at some point, we hope that, this trial will find the right dosage and, like I said, maybe eventually be able to put people like us in remission. Being a smoker for all these years, I swear I wish I could go back and tell my younger self to put the damn shit down. But I didn't, and here we are. So I'm not going to beat myself up over it. We're just going to move forward. Now, my surgery is going to take out part of my lung, my left lung, and cigarettes are out of the question. Now, what am I going to do about my use of marijuana for my anxiety? I'm going to have to talk to my doctors about that because I smoke it now, and the edibles I'm not sure about. I've used them before, and they don't seem to work as well, but, we'll see. Definitely can't smoke it anymore. So we'll have to figure out a different way. Maybe they have a medication they can give me. They don't like giving me lorazepam for some strange reason. And they say it's because of the morphine and Dilaudid I'm on, but, it is what it is. So we'll just have to, move forward and, just do the best I can. I might just have to figure out some other coping mechanisms. I already meditate. Don't think yoga's going to be in the works for me, though. I don't know about you guys, but yeah. I mean, I'm a pretty active person, but I don't know about yoga. But who knows? I'm willing to try anything, I think, at this point.